Hey, Dr. Picciarello here. A question I get asked often by doctors I'm working with is it safe to perform an injection on a patient that's anticoagulated? Now, we know we have a lot of patients coming into offices that are on either Coumadin, Xarelto, or Eliquis, and we wonder, do we need to call the primary care and have them stop the medication for a few days and bring them back for the injection, or is it okay to move ahead? Now, when I was in practice, we never really worried about it, but I never had any documentation that it was really safe. And I found this article. It's published in 2012, came out of the University of Minnesota. It was performed by their rheumatology department, and it's a rather large study. There's 256 people in the study group. There's 184 people in the control group, and the groups were divided by an INR of greater than 2 or an INR of less than 2. Since it was rheumatology, all the injections were either shoulder injections or knee injections. So they were divided fairly equally among those two groups. And they looked at complications in two different realms. They looked at early complications, which were within the first 24 hours, and late complications, which were from day 2 to day 30. And they found very, very few complications. In the early group, there was only one, which accounts for 0.2%. And it was an early bleed. It was somebody that bled from the incision site, required some pressure to the injection site, required some pressure to control the bleeding, and the patient left without any problems. There were 4 total complications in the late group. 3 were patients that returned for an additional physician visit for pain in the joint. They could not come up for a reason for that, but there was no hemarthrosis associated with that pain. And then there was one late complication, which they could also not link to the anticoagulation. The total complications in that group for the return to office was 0.7%, and for the late infection was again 0.2%. Now, this shows that it is very, very safe. Only a total of 5 complications out of 456 patients in the entire study. So it is safe in that population to do injections, and that's pretty much what I saw when I was in practice. I had the pleasure of this weekend to be out at the seminar with Dr. Runnels in Fairhope, Alabama, and I was able to sit down with him and share this study and also ask him the same question. Did he think it was safe to do one of his procedures, a vampire facial, a vampire facelift, vampire breast lift, O-shot, or P-shot in somebody that is on anticoagulants and has a therapeutic INR? And he agreed. He said that he thought it was completely safe. He doesn't stop any anticoagulants when he performs injections. I asked him if I could quote him in this video. He said absolutely, and he'll probably post this also on his website as well. So if you have that question, or you've been worried about that in the past, or if you've been maybe talking to the family doctors and stopping the anticoagulants, there's no need to do so. You can go ahead and just move forward. If you have any questions about this study or have any questions about the video, please feel free to reach out to me. Most of you have my email, so go ahead and just drop me an email. If you are watching my videos for the first time, please subscribe to my YouTube channel so I can find out who's following me. Have a great day and a great weekend, and I'll talk to you all next week. Bye-bye.